Okay, lift this leg, bend your knee, lift this leg up. Just like that, as far as you can. Hold it there, all right? Don't let me push it down. That goes down. Lift this one. Hold it. And Dave, that does work better if you go to the opposite side. Thank you. He helps me with these little hand placements sometimes. So I used to block on the same side as the hip. He says, why don't you block on the other side? It works better, and I tried it, and it does work better. So in the book, if it says block on the same side, change it. Okay, so he's positive there. Lift this leg up. Go back down. Lift this leg up. See the difference in the movement. So he's limited in internal rotation and extension on this side. He's weak in hip flexion at 90 degrees on the left. He's weak in resisted hip adduction and abduction. So all his hip musculature is weak. My main decision right now is where to start my treatment, because he's got so many different areas that are positive. I'm going to release, don't know why, I'm just going to release his hip first. So turn over on your back. And let your legs go flat. Now this is a little tender, there's a membrane right in here. First I'm going to treat it with you being still, okay. And then I'm going to ask you to oscillate, okay. In and out. Now, it's like taking a sharp dagger and putting it into soft wood. If you try to pull it out, it can't come out. But if you gently rock it, it'll slip out. So you can't go through pain. If you go through the pain, your body will resist. The faster and the least pain you can do, the better it'll work. Okay. So let me treat it first. So I'm going to go straight in, straight down, and this is the obturator membrane. And then I'm going to go in at about a 45-degree angle and three-dimensionally lock it up and recoil it and get out of there. Recoil is just almost like you're taking a spring and you're tensioning up the spring as tight as you can get it, and then you just back away from it. So I'm not pushing in and coming out, I'm coming right out as fast as I can get out. So it's straight down and then in at a 45-degree angle both that way and that way. We have a skeleton.
Should I feel pain here?
It might be a little sore, yeah.
A little tender.
Yeah, it's tender. Okay, now roll your leg into the tenderness. In and out, yes, actively.
It's increasing the pain.
Only go to where the pain starts. Don't go through the pain. He keeps saying this increases the pain, this increases the pain. I said, then stop, don't go as far. Yes?
Is there any specific amount of hold time before you recoil it?
The question was, is there any specific amount of hold time? Just when I feel I've built up enough tension. Right now, in as far as you can go, that's it, and relax.
Do you feel for release?
Yes.
Softening of it?
Yes.
A little sore now.
Yeah.
A little bit more sore than before.
Okay. Where I'm going is right in here. Okay, you find it by, you go right up along and where the adductors meet, and you just go kind of superior and inferior to the inguinal ligament. So we'll go over all this later. Okay. All right, just relax a second now. Hold your leg out there and don't let me push it in. Hold it and put it right up, boy. Good. All right, strength. That strength is back, and the leg is rolling in pretty good. Okay. Well, I'm going to treat the sacrum first. I'll stay on this side. Is that what you were going to say?
Laugh, Alan.
Huh?
Laugh.
All right, I'm going to go in on the sacrospinous sacrotuberous ligament. That a little tender? Sorry? Lift this leg up. Does that increase the soreness?
Not really.
Okay, up and down a couple times, and I'll release that.
It's going forward.
Huh?
The longer you hold it down.
Okay.
it's sore.
Okay, relax a second. All right, go.
And you don't do a recoil on that one?
You can. You can do that at any time you feel you want to move it along real quick. Okay, turn your toe in and slide your foot out to the side. But don't start to get the feel of the tissue release. Don't worry about you can do the recoil anytime. I mean, just try to get the feel of the tissue release. Go ahead, a couple more.
And is it releasing as he's doing the action motion?
Yeah, you can almost feel it kind of melt underneath your hands. Move over to the edge of the table. I want you to be able to touch your toe to the ground. Get your foot off the edge of the table. Yeah, but move a little bit further over.
Over?
Yeah. Now normally I would be standing over there a little bit. Okay, up and down. Good. Now touch your toe to the ground and keep it there. Now bend your knee up towards your elbow. Keep your toe on the ground. Just slide. There you go. But wait. You went way past it, didn't you?
No.
Go. There. And now back. Fast. Just to that spot. Okay, come back to the table again. Lift the leg again, just like we did in the beginning. Up, down. Now, did you feel that just release?
No, I didn't feel anything.
I'm sorry?
I didn't feel it.
Okay. Keep going. See his legs starting to go further and further and further before he hits the block? Keep going. And a boy. Good. Stop. All right, now go ahead and turn your toe in and go out to the side. Keep going. Fast. Mm-hmm. I felt which way the sacrum couldn't move. I torsioned it in both directions.
Are you stabilizing the sacrum?
I'm stabilizing the sacrum. Okay, go to the edge of the table.
So you're blocking it in the air in the direction that it wouldn't move.
I'm pushing it into the direction it wouldn't go. Okay, and now off the edge. Down, up. Good. Okay, now bend your knee, pull it up, and then straighten it. That's good. Keep going. Okay, stop. I'm going to do one more thing. I got to switch to this side for this. Relax yourself. Okay, just lift this leg up again. Up, down. What I'm doing now is I have one thumb on the sacrospinous sacrotuberous, the other one on a perceived tightness between the sacrospinous sacrotuberous and the sacrum. Remember I said about those anterior stuff? Be aware of them because we're going to be working with them. Okay, and slide your foot out to the side.